All right, Dan, so we're going to be doing a postural assessment. The postural assessment checks for different physical abnormalities. Okay? All right, so what I'm going to start with first is the anterior view or the frontal view. What I'm going to have you do is take off your flip-flops, please. I'm just going to have you march in place right now, please. Good, now just stop and have your arms to your side, just nice and relaxed. So what I'm going to be doing right now is just going to be assessing your posture. I'm going to be palpating through the test, is that right?
Yes.
Okay. So right now what I'm looking at first is I'm going to start from the top. I notice that your head is slightly rotated to your right. I can tell it's because your nose is not exactly in line with your chin. Do you mind if I palpate your sternum? Yeah. So just palpating right now to see your clavicle, move forward to your sternum. I notice that your chin is in line with your sternum. So the head is slightly rotated to the right. Mind if I touch your shoulders again? All right, so I notice that your right shoulder is slightly higher than your left, looking at the anterior view of your traps. This could be because of your dominant arm. All right, moving down, I can see that your right arm is slightly more lateral than your left arm. So that could be due to your arm dominance again. And I'm noticing that I can see your knuckles on both sides. This could be due to your your humerus being pulled anteriorly with internal rotation. Moving down inferiorly, do you mind just lifting up your shorts to about mid-thigh? All right, perfect. I notice that your knees are both facing forward. Your right leg is actually... Okay, I'm starting to do the lateral aspect. Let's take a march and squat again. All right, and relax. All right, so now from the lateral side, I can notice that your ear is slightly anterior to your humeral head. Your shoulders are slightly protracted. Moving distally, let's have you lift your shorts up. Okay, relax your knees. I notice that your knees look neutral. Do you mind if I palpate your lateral malleolus? Yep. Okay. Okay, and your lateral malleolus is in line. All right, Dan, so now we're going to check with the posterior aspect. Let's have you march and squat again. All right, and relax. So starting at the head, I'm going to check your just ears, make sure that you're in line, your head is rotating. Your shoulder on your left side seems to be a little bit higher, as we notice on the front. Could be due to arm dominance. Do you mind if I have you put one of your arms behind your back? All right, just feeling your, right, and relax your arm. Just feeling your inferior angle of scapula, they're both in line. Moving distally, mind if I palpate your hips? Yeah. Yep, all right. And PSIS are in line, lift your shorts up a little bit down. All right, and the posterior aspect of your knees are in line with the medial. So now we're going to be doing the H9 test, which is going to be our functional test. So what I'm going to have you do is stand with your feet about shoulder width apart, and have you march on the spot first. I'm going to be grabbing onto your hips just to stabilize, and then I'm going to have you do the capital H and a capital I with your hips, starting with capital H. This is going to be a side bend, which will have you lean back and extend, and flex forward, come back to neutral, go across, flex forward, back to neutral, and then extend. Okay? I know that your left side is the side that you've been having your pain on, so we're going to start with your right side first. Okay? So I'm just going to get down. I'm just going to brace your hips. Okay? Good. So you're going to side bend and then extend back. Good. And then come back to neutral, then flex forward, then go back to neutral, go back across, extend. Good. Come back to neutral, and flex forward. Good. Any pain? Nope. Nope. Okay. I'll demonstrate guy. That's the same thing as capital I. You're going to go forward. You're going to side bend to the other side. Come back up to neutral. Extend. Lateral bend to the left. Neutral. Lateral bend to the right. Is that right? Okay. So we're going to start with your right side first. Okay. I'm going to brace your hips and let's go. So you can extend back. Now side bend to the left. Then side bend to the right. Come back to neutral. And flex forward. Lateral bend to the right. And to the left. And come back to neutral. Does any of that?
Alright, Melissa, so now we're going to be doing the Braggart's test. It checks for spinal cord lesions. Alright, so what I'm going to have you do is lay on your back in supine. Alright, what I'm going to be doing is I'm going to be flexing your leg. So you may feel a bit of tension or tightness in your hamstring. Okay. I'm going to reduce the tightness, and then we're going to dorsiflex your toe, and then I'll have you raise your head up afterwards, okay?
Okay.
Right, so you said it was your left leg that was sore, so we're going to start with your right leg, okay?
Okay.
So just let me know when you're feeling a bit of tightness in your hamstring. Okay? There, okay. So I'm going to reduce the angle a bit. I'm going to dorsiflex your ankle. And I'm going to have you take your head off the table, put your chin to your chest. Any pain there?
No.
No? Okay, you can relax. You can relax your head. So now we're going to be doing Kemp's test. So what I'm going to have you do is you're going to stand in front of me, facing the same direction I am, and I'm going to have your left shoulder in front of my right shoulder, and then I'm going to have you just place it against my shoulder. You're going to put your head back onto my shoulder, and then we're going to be doing back extension and side flexion with a bit of rotation. Okay?
Okay.
So it's your right shoulder that hurts, right?
Yes.
So we're going to be starting with your left shoulder, okay?
Okay.
So I'm going to be standing behind you. You can just lean back a bit, place your shoulder onto my shoulder. You can place your occiput onto my shoulder. Very good. And now we're going to be doing back extension. All right, and we're going to do side flexion. And because it's your right shoulder, we're going to be doing rotation to the right shoulder. Any pain?
No.
Okay, and now we're going to try the other side. You're doing palpations, Bailey. So I'm going to be starting with your lumbar spinous processes. So do you mind if I lift your shirt up a little bit and covering your lower back? And I'm going to be lowering your shorts to your PSIS. Is that all right?
Yeah.
All right. Just palpating your PSIS. Perfect. So to find the lumbar spinous processes, I'm going to be starting at your iliac crest, laterally and posterior. And from here, I'm just going to be moving medially And I can find the largest bony prominence. This is going to be your L5. So that is the bottom of your lumbar spinous process. Now just moving superiorly, I can find L4, L3, L2, and L1. So these are going to be your spinous processes in here. Temperature, it feels the same temperature as the rest of your tissues. There isn't a color difference between the rest of the tissue. Texture, it does not feel granule throughout the spinous processes. Does it hurt when I compress or palpate?
No.
No? Okay. So I can just raise this back up. So now I'm going to be going from the L1 up to T12, T11, and T10. This is going to be the origin of the semispinalis thoracis, and it's going to be moving superiorly and medially up the back. To palpate this, do you mind just extending your head back and also your back? All right. And here I can feel the semispinalis thoracis. It does not go down into the lumbar spine, and you can relax. Good. Thanks, Bailey. So now we're going to be doing lumbar range of motion, which is flexion, extension, lateral flexion, and rotation. We're going to be starting off with active and passive range of motion. So I'll have you do the active, and then I'll apply a bit of overpressure. Is that okay?
Yep.
So first we'll start off with flexion. What that looks like is hands on your thighs, bend at the hips, your neck is going to be, or chin to chest, and go down as far as you can. Once you reach there, I will apply a bit of overpressure. Do you mind if I palpate?
Yep.
Okay. Is that okay?
Yep.
No pain?
No.
All right, so that was about 60 degrees, so that's a healthy range of motion. Now we're going to be doing extension. So what I'll have you do is just place your hands on your hips and then lean back. Whenever you're ready, I'll place a bit of overpressure. Is that okay?
Yep.
Okay, I'll just place my arm across your chest, supporting your lower back. Is that all right?
Yep.
No pain?
No.
Good. So that's about 20 degrees, 25 degrees. That's about a healthy range of motion. So let's have you sit up here. All right, and now we're going to be doing side flexion. So what I'll have you do is just have your elbow at your side, and then as you side flex, go until your elbow touches the table. If you can go farther than that, then spread it out a bit. No pain?
No.
All right, so I'll apply a bit of overpressure here. All right. Any pain here?
No.
All right, so let's try the other side. Any pain?
No.
All right, apply some overpressure. No pain?
No.
Good, so that was also about 25 degrees. So now we'll do some rotation. So what I'll have you do is just twist your body at the hips. No pain?
No.
All right, we'll just apply some overpressure here. No pain?
No.
All right. Now for the next side, I'll just apply a bit more overpressure. No pain?
No.
All right. All right, Bailey, so now what we're going to be doing is resisted range of motion for the lumbar spine. So for this, I'm going to use this as a bit of a divider, just so that we have a bit more space, okay?
Yep.
So I'm going to be placing this against your shoulder, and then I'll place one arm above your clavicle,
Okay.
just so that we have a bit of space here, just so I can actually get some leverage. So what I'm going to be doing here is I'm going to have you do the same ranges of motion, but with me resisting, so that I should match your resistance, okay?
Okay.
All right, so what I want you to do is first flex forward, and I will resist, okay? Any pain?
No.
No, okay. And let's have you extend. Any pain?
No.
Okay, let's have you side bend away from me. Any pain?
No.
All right, let's have you bend towards me. No pain?
No.
All right, let's have you rotate so that this shoulder's going forward towards me. No pain?
No.
All right, and let's have this one going backwards. Keep your head neutral. No pain?
No.
Good.